and Gail, and thanks for being here today. And thanks to everyone who is connecting right now for today's session. We're here for today's AppleChat Healthcare webinar on inflation and healthcare, how to mitigate the impact of nurse recruitment. My name is Elliot Stewart, and I'm a digital marketing and business development associate with AppleChat Healthcare. AppleChat works with healthcare organizations in the USA and Canada to help them find and hire more nurses. Our speciality is sourcing passive nurse candidates from outside of job boards. We also screen and engage with every applicant to make sure they're a good fit for our healthcare clients. To find out more about what we do and to access our free resources, please check out Patrick's online business card. We'll put the link in the chat. At that page, you can access the following. You can join our Nurse Recruitment Secrets Facebook group to share and learn more great ideas regarding nurse recruitment. You can also subscribe to our monthly Nurse Recruitment Secrets newsletter. You can view all of our past webinars on nurse recruitment and sign up for our future free online events. You can also connect with Patrick to learn more about AppleChat Healthcare's nurse sourcing and screening services. Feel free to send them a message here in the chat or on LinkedIn as well. So, moving on to the agenda, the webinar today will discuss the ways economic inflation is affecting healthcare and how it directly affects nurses. And it will explore some ideas that healthcare organizations can implement to mitigate the negative impacts of inflation on nurse recruitment and retention efforts. I'd now like to introduce today's speakers. Patrick Thiele is the Chief Operating Officer of AppleChat Healthcare. He has been with AppleChat Healthcare for over 2 years, and he previously worked as a senior manager in the Canadian criminal justice system for more than 25 years. Hi, Patrick.
Hi, Elliot.
Patrick is joined today by our webinar guest, Gayle Morris. Gayle worked in healthcare for many years as a pediatric nurse practitioner. She also worked in a hospital human resources systems and was unit director at a rehabilitation hospital in Indianapolis. She also undertook medical outreach at the Voss Children's Hospital in Grand Rapids, Michigan. Based in Ohio, Gayle now works as a freelance writer, working on various topics with a focus on healthcare. Welcome, Gayle.
Oh, thank you, Elliot.
We're sharing Gayle's LinkedIn contact info now, so feel free to connect with her there as well. We love it when our webinars are interactive, so please post your questions and comments in the chat at any time during today's session. Thanks again to everyone for joining us today, and now I'll turn it over to Patrick to start the discussion.
Great. Thanks so much, Elliot, for the introduction.
Pleasure.
And thanks to Gayle for joining us. This is great. And I knew this would be a popular topic, and we've had a lot of people respond with interest and looking forward to today's event. So we appreciate, Gayle, you joining us and to talk about this important topic. And we sure know that everyone is feeling the effects of the rising costs of goods and services in the recent months. And while we're hearing in the news that maybe there's some signs that inflation may be slowing in the US and Canada, that's a good thing. I heard it referred to or described as sort of like a speed limit on the highway. If the speed limit is 60 miles an hour and you're driving 80, but you slow down to 75, you're still speeding. So we're still speeding ahead with inflation, and all signs are we're going to be dealing with this for some time to come. So I think this is still a topic that people are really interested in. And of course, inflation affects the entire economy and the entire population, including healthcare organizations and individual nurses in their homes and in their families. And this can certainly impact nurse recruitment and retention. And that's a focus, as Elliot said, that's a focus of our work at AppleChat Healthcare. And that is something that many of the people in our audience today are particularly concerned with. So we thought we would talk about this today and see if we can raise some awareness and perhaps explore some ideas to help mitigate the challenges. So Gayle, thanks again for joining us. You recently wrote an article for Nurse Journal called 4 Things Nurses Should Know About the Current Economy. So thanks for posting that. We've actually also posted that on our LinkedIn page this morning. And so you can find that on our AppleChat LinkedIn page. I'll post that in the chat here now as well. So you can go over to our LinkedIn page and find Gayle's article. And Gayle, you talked about you started by talking about the way the economic inflation is affecting healthcare, and you outlined a few ways that that's happening, how it's impacting the delivery of healthcare and healthcare organizations. I noticed that you wrote that healthcare is not a normal industry and that its costs are not impacted by supply and demand in the same way as other goods and services. Can you tell us what you found and what you wrote about that?
Sure. The healthcare is impacted in some degree in the same way that we are with inflation, but a good half of their costs of doing business is not. And so let me tell you a little bit by what I mean by that. And I have to back up a little bit and give you just a little bit of history.
Sure.
History is not always that fun, but I'm going to try and go through it as fast as possible.
Sure.
In the 1960s, sometime before a lot of us, remember what it was like to pay bills, healthcare was paid in a large part by private funding. So private insurance, and people paid for it privately. And then as that population, the lost generation, got older, and the rates of chronic disease increased, cancer, heart disease, and other chronic diseases. Private pay individuals and private insurances were overwhelmed, and the government realized that people were getting lost in the cracks as far as insurance and being able to keep up with their health care. So two things happened. Right after World War II, the government made employer-sponsored insurance exempt from income tax. And so that was a bonus for the employer to be able to offer insurance to the private individual, to the employee. And then Medicare was established in the 1960s to help, stem that gap. By 2010, so before that, 80% had been paid for by private insurance, and 20, was government public funding. By 2010, that was nearly equal. And today, the percentage of public funds for healthcare exceeds the amount paid for by private insurances. And so we're finding that Medicare, for instance, covers 63.9 million people, and Medicaid covers 82.7 million people. So Medicare, for people who are not familiar with the Centers for Medicare and Medicaid Services, they're the two public funding services for insurance. Medicare covers the elderly and the disabled. Medicaid was created as a safety net for families with children, pregnant women, disabled individuals, and low-income adults. And so those are the kinds of groups that Medicare and Medicaid cover. Now, there are other government-sponsored insurance policies and funds as well. And then all told, Medicare, Medicaid, and the other government funding sources, they account for 52% of all healthcare payments that go to hospitals. So hospitals are a private kind of entity, and they are significantly funded by public funds, by government funds. And so it creates this oddity, since the public funds are paying for, an individual, and they're not as impacted in that respect by inflation. That's half of what the hospitals have. However, in 2018, when they looked at, when you look at the statistics for 2018, only 90% of the costs that the hospitals billed to Medicare and Medicaid were paid. So 10% of what they charged were not paid. And that's a big percentage for the hospitals, when 52% of what they're getting paid is, 10% of it is not they're not receiving funds for.
Right.
And this is, they think, experts estimate that this may force providers in hospitals to try and cut costs even further than they have in trying to keep up you
It's a
know,
massively complicated challenge, and it can take years for the system to catch up with the costs. And even though costs are increasing quickly, but the reimbursements can take years to catch up as
yes,
well.
yes.
And I will say, as a Canadian, I know we'll have a few, some Canadians in our audience. It's a little bit different in Canada, but of course, even in Canada's publicly funded healthcare system, the government funding is struggling to keep up with the rising costs as well. So similar challenge there as well. Yeah, very complicated challenge. We hear all the time about the cost of labor increasing, and of course, in our world, in particular, nursing, but it's not just labor costs that have increased. And you talked in your article about other costs increasing as well that hospitals are having to deal with.
Yes, you know, labor is their biggest. It's 50% of their expenses is labor. But hospitals are also dealing with, especially in this the last 2 years, they're dealing with this historic volume of patients coming through. And they're also, you know, you would think that would be great. I mean, you know, they have a lot of volume. That must mean they have a lot of patients and they're going to be paid more and it's going to be okay. But they're also dealing at the same time with revenue losses, not because of higher labor costs, but because the what I just talked about. And so you have this massive volume of patients, many of whom were 65 and older, impacted by the pandemic, and they're on Medicare and Medicaid. Medicare and Medicaid is not paying everything that they're being charged, and the hospitals are also not taking in elective surgeries, which is where they make a lot of money from private pay insurances. And so they're experiencing revenue losses from that, as well as skyrocketing expenses with drugs and supplies.
And yeah, you talked in your article about the increasing cost of supplies because of the increased demand over the last couple of years. We know pharmaceutical costs have largely increased. And of course, the cost and the demand of personal protective equipment, which was not what it was 2 years ago, 3 years ago, is not what it is today. It's a totally different world. So costs have really expanded massively. And then, of course, the supply chain issues that have led up to where we are now dealing with inflation. So so another huge challenge for healthcare organizations.
Their drug expenses for the hospital has increased by 36.9%, and the supplies have increased in cost by 20.6%. So those are massive increases in costs when they're not getting the revenue that they expect from that. And on top of the cost of PPE being higher, they're also using it at a higher degree. Yeah.
Right. Of course. So, of course, as nurses, we talked about the cost of salaries, and as nurses and other healthcare professionals struggle to make ends meet in their personal lives, they're adding some pressure on the healthcare organizations to get higher wages, and that's a huge challenge, of course. So let's move into how how economic inflation is directly affecting nurses, as I say, in their daily lives.
Oh, wow. That's well, I can speak to that from personal experience. It's been huge with grocery prices being higher and gas prices being higher, and nurses unsure of, even though there's a high degree of patient load in the hospital, the job market is not as stable as you might imagine. And so nurses are also facing some of the same issues with when the patient load goes down, when the patient census goes down, sometimes they're being asked to go home because there aren't enough patients in the hospital for them to work. So it's not a salaried position. So when you go home, you don't get paid. And that's, kind of where what happens for them. And so when NBC News did a survey this year in March, and 62% of the people that they surveyed said that their family income is falling behind the cost of living. And as the cost of living, raising, 55% said that inflation was their biggest concern, and they weren't sure how they were going to pay for gas in the car. That was one of their biggest things, was transportation and getting paid for, or being able to put gas in the car.
Right.
So,
Yeah, that's something, a very practical thing that we hear from our healthcare organizations who are our clients often, is that nurses are saying, we're not interested in commuting. I'm not going to commute more than 30 minutes anymore. In the past, maybe it was easier to recruit nurses to commute a longer distance. That's becoming a much, much bigger challenge now because of the cost of gas and of course, some of the other pressures that have happened in the last couple of years. We also hear very often from our talent acquisition folks that we talk to in healthcare, that the cost of housing in many communities and many cities, whether it's a larger city or maybe a more isolated community, cost of housing is a massive challenge, and massive in the sense that our talent acquisition folks can't do much about that. That's a very, very big challenge. So cost of housing, which has increased generally across the board, is something that a lot of organizations are dealing with recently as well, which is obviously going to affect nurse recruitment if nurses are no longer interested to relocate, or is just affecting their willingness to change and work in a particular location.
Right. Well, I can actually speak to that personally, Patrick. I was amazed. I recently moved into a home. I've been living we had lived in a home for 20 years, decided to move into an apartment for a short time to be able to make a transition in my life, and moved into my new home. It'll be 2 years this December. And when I called, I wanted to see what the apartment went for after I left, so I knew how much I paid. And 5 months, I think, after I moved out, so that I moved out in December of 2019. And when I moved, I think it was 2019. I'm really bad with years. No, I think it was 2020. Anyway, 5 months later, the cost of my apartment in 5 months went up $500.
Oh my goodness.
Yeah, it was amazing. And the house that I bought in December was another person sold their home down the block, and it went for $50,000 more than I did. And we have the same square footage, we have the same interior. It was not anything, massively different.
Those are not small numbers. Those have a big impact on individuals and families. Wow.
Yes, definitely.
So let's move into what probably our audience is most interested in. What are some things that healthcare organizations can think about in terms of strategies to mitigate the negative impacts of inflation on nurse recruitment and retention efforts? So obviously, I'm sure every organization, if they could increase pay to meet nurses' demands, they would love to do that, but that's obviously not always possible. And you talked about how healthcare organizations are dealing with other expenses, which is affecting pay. One of the things some of our healthcare organizations talk about as well is trying to implement the use of retention bonuses. We talk a lot about recruitment bonuses, signing bonuses these days for nurses, but a lot of organizations are maybe getting pressure from their existing staff and also really trying to focus on retention and looking at ways to help mitigate that by giving them some funds to keep them in the job, but also address their inflationary impacts that they're feeling at home. So that's an idea that healthcare organizations, if they're not already looking at that, can think about if that's something that they can fit within their budget or find the budget to implement. You talked about the costs across the system, and in your article, you talked about using technology to reduce hospital expenses. We won't get into that in a lot of detail today, but can you share any more about what you learned about that idea?
Some of the technological things that hospitals have been able to do is to use it for track their supplies better, to do a better job of, oh shoot, oh that's bad, went out of the brain.
We'll come back to you.
It will come back to me. It will. I know that a lot of nurses are also using technology on their smartphone to become more productive on the floor as well, and to be more productive on the floor. But hospitals have been finding that mostly in in the billing department, in getting payment and reimbursement, the longer it takes a hospital to be reimbursed by either private or public insurance, the harder it is on them financially.
Sure.
Because when you think about it, it's a free loan. It's basically a free loan. And what they're finding is that, especially for private pay patients, 23 million Americans right now have unpaid medical debt. So on top of, the 90% that they receive from public funds, the people whose private insurance did not cover all of their medical expenses, 23 million Americans are not, have this unpaid medical debt that they have to somehow take care of. And that's impacting the hospitals. Now, if hospitals can do a better job in their billing department to justify hospital expenses to the insurance companies, if they can work with patients up front in setting up payment plans, if those kinds of things can be identified early, then they have a better chance of getting reimbursed. And that's where they're using more technology to identify, patient accounts where, patients are not paying their bill because they don't want to. They're doing it because they can't.
Right.
And, for a patient to pay $50 a month may not feel like, oh my gosh, my bill is $10,000, $8,000, and how is $50 a month going to help? And yet, if the hospital has 2,000 patients paying $50 a month, it's not a drop in the bucket for them. Right. So they need to be able to identify those patients that they can get on a payment plan and get started.
Okay, that's great. Thank you. You also talked about implementing family-friendly programs to help nurses and other healthcare staff deal with inflation. I thought this was really an interesting topic area. Let's go through some of the ideas that you found.
Sure.
Programs.
Okay. Some of the family-friendly things that we, can offer to nurses, that hospitals can offer to nurses, can help mitigate the impact that inflation has on their home, on their bottom line. So some of these things hospitals can do don't cost the hospitals very much, and yet it puts money right back into the pocket of the staff nurse. And that's important when you're looking at retention, because offering me a high salary may attract me to your hospital, may attract me to working at your hospital. But if that high salary and that salary is not keeping up with inflation, it's not helping, it's not giving me everything that I need, then I'm more tempted to move on to try and do contract work. And that, of course, costs the hospital even more. And
right.
So when hospitals can, do other things like, well, I always start out with, it's so important to listen to the nurse. It's so important to ask the staff, talk to them, ask them what their concerns are, ask them where they, if you have a high number of staff who are younger, are just starting their families, they're looking at high daycare costs. And so we're seeing some hospitals that are using unused areas of their hospital, doing some really minor renovations and bringing in daycare into the hospital. Yeah. And so they can hire pediatric, certified pediatric nurse assistants, and they're able to do the care. So now you have nurses who know that their children are in the hands of somebody who's had a criminal background check done, right, has some medical care in the same building that their children, that they are in. In some hospitals, like when I used to work at DeVos Children's Hospital, and this was, I don't want to say how many years ago it was, but it was many, many years ago. Sure. And I had a baby, And they offered daycare in the building for the first 9 months so that moms could go down and nurse their children for the first 9 months.
Wow.
And that was a massive thing for retention.
That's a big peace of mind, a big stress off of working moms, and also it's going to reduce the cost that they're dealing with in terms of daycare as well. That's a really interesting idea. You also mentioned the parking challenge. The cost of parking is always a big cost, especially in the larger cities. You mentioned the idea around the parking.
Well, some hospitals are able to cut their costs for the staff by charging for parking only what it costs them to maintain the structure. So while the structure is already in place, any kind of upkeep obviously needs to continue. Security, lighting, that kind of thing to maintain the structure and maintain the safety of the staff, but they don't have to charge more than that.
Right.
So the hospital's not losing any money. And the staff is getting money back in their pocket. And for larger cities, then some hospitals are able to negotiate a lower cost on transit.
Right.
And if you're not, then you also have hospitals that are negotiating better gas prices for their staff at specific gas stations.
Right, discounts or gas cards. I've also heard about hospitals offering discounts, negotiate discounts on mobile phones, insurance, gyms, which is also useful because that's a wellness initiative as well to support people who are under a lot of stress in work and personal life. So discounts on gyms are always a good thing. I've also, related to wellness, also heard about the idea of really hospitals trying to do more or look at their peer support program. So if they don't have a peer support program, to try and develop one, or if they do have one, now's the time to make sure that your peers are equipped to deal with financial instability, financial crisis, so they can better help their colleagues. So wellness in general, anything you can do around that, but in particular, a peer support program can be really helpful as well.
Oh, definitely. And that also ties into mental health as well. So not just financial crisis, but also nurses face a massive problem with burnout. They're in this position of helping and taking care of patients every day who they are seeing people often at the worst time in their life. Yeah. So, it takes a psychological toll.
And all of these things we're talking about, as you say, they have individual impacts, but all of them are pieces that nurses will look at when they're considering staying with their employer or considering moving to a new employer. And of course, with our clients and that are recruiting nurses, we hear that all the time. They're looking at ways to try and attract people into their organization. Again, another item specific to financial difficulties is offering employees a chance to have a matching program for retirement investment. Many employees nowadays with inflation may not be saving as much, or maybe they're actually spending their savings because of rising costs. So if there's a way that we can help them save funds through a matching program, that can have a big impact. And also I've heard of organizations offering financial planning or offering access to a financial coach to address questions as well.
Right. And getting those nurses to stay, increasing the retention in the hospital reduces the hospital cost. So while we're talking about things that sometimes cost the hospital a little more money, like a matching program or hiring an accountant, not an accountant, but a financial planner to work with the families and work with nurses and staff. We're also talking then about doing exactly what your company is doing, which is helping hospitals to attain qualified staff and keep them permanently. So now we're looking at reducing the cost of contract staff and travel nursing, and this costs the hospitals less money. So in the long run, by keeping, because the nursing shortage has been a real issue across the country, but the current shortage started in 2012.
Right.
And even in
many years.
Yeah, so even in 2012, they were talking about this particular shortage being the biggest and the greatest shortage that we've seen in this country, in the U.S., for decades, since the 1900s when they started actually tracking it.
Right.
And so then with the pandemic, even more were getting burned out and leaving, and not necessarily retiring, but moving on to a different career or moving out of the hospital system, and it increased the shortage even greater. And so there's only so much you can do. There's only so much you can do to stop the shortage or to reduce the shortage by increasing the number of nurses. So it's nice to put more nurses into the pipeline, but retention is absolutely what has to happen in order to keep this, to develop better patient care so patient outcomes are better.
Sure. Healthcare organizations have to look at every opportunity, retention and recruitment, and every piece under those umbrellas to try and keep and bring more people in. Absolutely.
Right.
One other item I heard recently, which was of a hospital doing specifically to deal with nurses that are dealing with the rising costs in their daily life, is offering daily pay. So if a nurse takes a shift, it's an extra shift, perhaps they don't have a full-time position, or maybe they're taking an extra shift beyond their full-time position, the chance to get paid at the end of their shift. So if they have a specific expense, maybe they've had an appliance that they need to replace or an extra cost with their children, they may be willing to take an extra shift at work if they know they're going to get paid quickly and not have to wait a couple of weeks to get that money in the door. So that's something I hadn't heard recently, and until recently, and thought that was a really interesting and innovative idea as well. So there's a lot of things. We've covered a bunch. I'm sure there's more out there, and I would encourage people to share your ideas in the chat or on our LinkedIn page as well, where we posted Gayle's article if you have ideas that you want to share as well. So Gayle, that's great. Anything else that you wanted to, that you were thinking about, that you found when you were researching the article, or anything else that you wanted to add about this topic today?
Yeah, there was actually one that really kind of surprised me. There was a study done in 2017 that showed that there was a direct link between nurse residency programs for new nurses, for new graduate nurses, and retention. So they found that the nurses who were new, who went through a nurse residency program, stayed with the hospitals longer. And this was, back in 2017, stayed with the hospitals longer. They were more satisfied with the onboarding process, and they were more satisfied at work.
Okay.
And there was something about, it wasn't just mentorship. It wasn't just mentoring another, new graduate. It was a whole program developed for new graduates, and it didn't cost the hospital much at all. And it really was a low-cost way to keep new people.
There's something about some loyalty that comes in, right? If people start working with an organization, they feel at home. We've also done a webinar in the past about the use of an employee referral program and how valuable that is to bring new nurses to your organization. If your current employers are recommending it and bringing people in, people come in and feel they have a support, and they're not starting cold with a new organization. They have someone they know already there. And the retention rates are much higher as well if they come in with a nurse retention, a nurse employee referral program as well. So lots of ideas. And if people go back and look at our YouTube channel with the webinars we've covered over the past couple of years, you'll find some topics that you might be interested in as well. And so on that note, I'm going to share again my online business card, because at that link, there is the link to our YouTube channel to find those webinars, sign up for future webinars, sign up for our Facebook group and our newsletters as well. And with that on the screen for people, Gayle, any last comments that you have today?
No, I think the most important thing out of all of it is to talk to the staff. Talk to the staff, listen to what their concerns are, and get them to help in developing the solutions. Because it's one thing for people to complain, but once they start to help in developing solutions, they get buy-in, and they honestly become more ingrained in the organization, they develop loyalty with the organization, because now not only is the organization listening to them, they're actually taking their advice, they're actually trying to implement some solutions that they came up with. And you have staff then whose needs are being answered, but who also feel valued.
That's great. Well, thanks very much for those thoughts from your nurse experience and the recent research you've been doing as a freelance writer and writing about this topic, and lots of ideas for people to think about. And we really appreciate your time today. And we encourage people again to reach out to Gail or to me at AppleChat if you want to find out more or and reconnect for some of our services that either of us can offer. So thanks very much, Gail. Have a great day, and we'll be in touch.
Okay.
Thanks for joining. Bye-bye.
Bye-bye.